So now that our positive cases are going down in the hospital, when are we going to revisit our visitor policy?
Well, we are always revisiting the visitor policy. In fact, we've been doing that from day one. Because as I say often, that was the most difficult action that we ever had to take to protect our patients and our employees and visitors and doctors, was to really restrict visitation. We've always had, the exceptions in place for end of life or developmentally disabled patients, or those that can't otherwise communicate for themselves, the birth of a child, things of that nature. But it's almost been weekly throughout the pandemic that we have evaluated, are we at the point where we think we can loosen it up? And that point has just arrived again over these last 3 weeks. As we've seen the number, kind of hover steadily at that 20 COVID inpatients per day. About a week and a half ago, our command center, all our section chiefs met, had a lengthy discussion. We have an actual committee that focuses on the visitation policy, and so we kind of put it on them to propose something that would reflect a loosening. So I'm delighted to report that starting Monday, 8 o'clock, this coming Monday, what is that, the 19th? I think so.
Yeah.
Yeah.
What day is it?
So we will begin allowing every patient that's in the acute medical center to have one unique visitor. The visiting hours will be from 8 a.m. to 8 p.m. Every day of the week in the acute medical center. I say unique visitor because we don't want 10 visitors, one every hour, rotating in to see the patient. Because again, we're still concerned about limiting exposures. And again, it's because such a high percentage of people that are infected and contagious are totally asymptomatic. So they feel perfectly healthy, they look perfectly healthy, they exhibit no symptoms, but they're still contagious. So that's why we're still, we want it to be one unique visitor per day. Now, that doesn't mean that it can't be, a son Monday and then the daughter on Tuesday. It has to be, that single person that day. We will screen all visitors that come in, temperature and questions. They will have to, they'll be required to wear a mask, a surgical mask. At this time, we're not allowing visitation of COVID positive patients, unless it falls into one of those exception categories. If it's a patient that has COVID that death is imminent, or again, developmentally disabled, or unable to communicate on their own, or they're going to undergo, kind of a very severe surgery like open heart surgery or neurosurgery. Even if they're COVID positive, we do allow visitors under those exceptions. The emergency department is, for the time being, is going to continue to be more restrictive. So again, from the beginning, we've allowed the charge nurse the discretion to allow a visitor back into the exam room with a patient. So that discretion has existed since really the beginning of our new visitor policy, but we're going to keep that restriction still in place. But we will continue to look to change that over time. At our South Campus, which is our 54-bed skilled nursing facility, both subacute and skilled level care. That was one of the units that was locked down very restrictively at the beginning. But beginning there on Monday, we will actually start allowing 2 visitors at the same time to visit in that skilled nursing facility. Again, full screening. Anybody that's exhibiting COVID symptoms would not be allowed to come in. But if you are exhibiting no symptoms, again, wearing a mask, allowed to visit throughout the course of the day. Now, because of the more congregate living of that and the more vulnerability of that population, we're not going to allow visitation every single day. So the visitation will need to be scheduled, through the facility, and it is going to be more limited. So it may only be one day a week. I think they may, I don't know if they're going to start out one day a month. It's a longer term facility, but those details will probably be fleshed out between now and Monday. But 2 visitors per patient, scheduled, more structured, but not every single day. But definitely it's a wonderful change that is allowing, more visitation. We definitely, we believe that visitors play a huge role in helping patients heal, calming their anxieties and fears, which helps the body heal when it's not under tension,
Right.
but also helping the caregivers, helping communicate information, helping calm the patient and helping them listen. So it actually, this strict visitation policy is really negatively affected our ability to take care of a patient. So nobody is probably, more upset by it than our nurses and our doctors, because they know the strength of visitation. So, and then lastly, on the West Campus, so our rehabilitation hospital out there, which has 45 beds of acute rehab, 16 beds of skilled, short stay skilled. They're going to stay still pretty restricted at this time. They do allow families to participate in training of acute rehab patients, but they'll stay a little bit more restrictive. But again, we're going to continue to evaluate. One of the things that I think we're holding off until October 26th, so 1 week from this coming Monday, is we will begin to allow a visitor to go into the surgical waiting room with a surgery patient and to go back with them in the preoperative space and to stay with the patient until they're taken into surgery. And then we'll continue to keep the visitor, the loved one, informed about what's going on. And then when they come out of surgery, to be able to go back to them in the post-surgical area and be by them. So that is probably one of the most significant changes, because obviously surgery is a very anxious time. And I know that some people have actually put off surgery, elective surgery, because they couldn't have a visitor and they didn't want to be in here by themselves when they were going to undergo surgery. So that change will happen on Monday, October 26th.
Okay, so that will roll right into the next question of, are we expanding our surgical procedures? Non-essential, non-emergent?
Yes, in fact, that is now done. There are no restrictions remaining in place on surgery. So that just occurred probably about a week ago. As the numbers have stayed down, as testing supplies have become more available, because we do test all elective surgery patients 48 to 72 hours before their surgery. We actually will soon start testing every surgical patient. Even those that are already in-house or in an inpatient bed awaiting surgery, or they need surgery, we'll begin testing them. But now there are no restrictions. So all elective surgeries, inpatient or outpatient, are now being scheduled by our surgeons. There's still a backlog. It's still going to take a little bit of time to catch up, but all the ORs are running, and surgery's back to full scale now.